Hi, this is Dr. Divya Sundaresh. I'm an Oculoplasty surgeon. I am a surgeon from Bangalore and I also work at Zamindar's eyes. Thyroid eye disease affects people who can be hyperthyroid or have Graves' disease commonly. It can rarely also affect people who are euthyroid or also hypothyroid. Now, thyroid eye disease has two phases. There's an active phase and a stable phase. Generally, the active phase lasts for about 3 months to 2 years and subsequently is followed by the stable phase. It's prominently featured with prominent eyeballs, redness, pain, and watering. And this can also have complications like corneal ulcers because of very prominent eyes. It can also have, because of a lot of pressure, it can also lead to secondary kind of glaucoma. Thyroid eye disease commonly affects women more than men, generally in the age group of about 40 years and above. So, generally, it's recommended that most people undergo a thyroid function test, especially women after the age of 40 years, on an annual basis. Signs and symptoms of thyroid eye disease can start with very simple things like dry eye, gritty feeling in the eye, swelling around the eyelids only during morning or which can persist throughout the day. There can be congestion more commonly in the ends of the eyes, like where the muscles are inserted. There can also be redness throughout. There can also be watering, discharge because of prominent eyes causing more exposure and more susceptibility to developing infections. There can also sometimes be double vision when the eye is not moving correctly and both eyes are not moving synchronously. This can cause double vision or what we call as diplopia because the thyroid disease affects the muscle tissue as well. Now, these are the common signs and symptoms of thyroid eye disease. The most important test will first be the thyroid function test. Along with the thyroid function test, we'll also want to do the free T3, T4. Sometimes also the thyroid antibody levels need to be checked. Then we'll also need to look for any thyroid gland swelling and may require a scan of the neck. Also, we'll need to do if the eyes are very prominently bulging, then CT or an MRI of the orbits will also be done to assess the amount of the problem. So the treatment involves many aspects. Now, when it comes to the initial phase or the active phase, depending on the severity of the disease, it may require medical management on an aggressive basis with the use of intravenous steroids to make the disease come to the stable phase at a faster level. It may also require local treatment where we need to use lubricants, and if the eyes are very prominent, then we may need to do surgery where we might need to close the lids partially so that the cornea or the front portion of our eye is not exposed. Now, when it comes to the stable phase where there is only prominent eyes but the disease is inactive, but the prominent eyes is not acceptable cosmetically, then a decompressive surgery can be done where the eyes can be made to move a little back again, like how it was, not perfectly like how it was before, but to a large extent it can be corrected. Now, when it comes to double vision, generally we wait for the stable phase to start. Only then we can plan to do any kind of muscle surgery. Surgery is not generally advocated in the active phase unless there is some vision threatening complication. For double vision, we can do muscle surgery to correct the double vision. Thyroid eye disease cannot be prevented, but like I said, it is necessary to do the thyroid function test on a regular basis so that we can catch the disease earlier on. Once you're diagnosed either with the physician or with the endocrinologist with thyroid problems, or when you come to the ophthalmologist with prominent eyes, it is essential to undergo frequent examination in the initial phase so that it can be treated as early as possible. So the eyes bulging is because there is severe inflammation in the tissues surrounding the eyeball. So that is causing the eyeball to be pushed outwards. So this is the fundamental problem in thyroid eye disease. Yes, you can have thyroid eye disease even if you are euthyroid and hyperthyroid, which is when the antibody test will also be indicated.